It's still good morning, Cross River, on a feeling terrific and top-notch Thursday morning. We're talking health right here, and we have in the studios Mr. Clement Sunday from Cervical Diagnostics and Medical Center. He's a lifestyle expert. Good morning and welcome to the program.
Thank you very much.
It's always a pleasure having you in the studios every Thursday.
It's my pleasure.
And today we're talking about cervical cancer and the prevention and also the prevalence. So, whenever people get to hear cancer, everybody's shivered. Everyone's scared. So, tell us, what's cervical cancer really about?
Well, as people hear cancer is not a death sentence if detected early enough. Cervical cancer can simply be described. Let me explain in a way that people would really easily understand. The women basically have 4 reproductive organs: the cervix, the vagina, the uterus, and the ovaries. Now, the cervix is the entrance to the vagina. So, once you have some activities of abnormal cells, that's what you say cancer is. And when that happens in the cervix, it's regarded as cervical cancer. We have basically 2 types. We have the ectocervix, which occurs at the entry of the cervix into the vagina. That's the ectocervix kind of cancer. Then the other one is the endo, which happens inside the cervix itself, which occurs inside the cervix itself. So those are the 2 basic type of cervical cancer.
Okay, so who is really prone to having this particular type of cancer? Who is at risk of having it?
Every woman who has had sex is prone to have, because it's caused by this human papillomavirus.
HPV?
HPV. So every woman who, number one, who has had sex before is prone to have this virus. Then women who have multiple sexual partners, or who have partners who have multiple sexual partners, that are prone to have contact this virus. Or women who have STDs, sexual transmitted diseases, or women who have this who are immunosuppressive drugs, such as someone who has just received a kidney transplant or an organ transplant, which their immune is very down. They tend to have this virus as well, and as well as women who have HIV or AIDS, they are prone to have this virus. Studies have also shown that women who have multiple children, the more children you have, the higher your risk of having this virus as well. So there are a lot of them. Women who smoke, so once you are a woman and you smoke, you tend to have this kind of virus.
Okay, so deducing from what you've said, it's like if you have the human papillomavirus, then you are prone to having the cervical cancer. Is it that the HPV causes the cancer?
Yes, studies have shown that it is the HPV that is responsible for the cancer, but it is not all cases of HPV that literally translate into cancer. We have the persistent HPV, because normally people have it and after a while it will disappear, but some stay, no matter what it does, it stays and stays there. So those kind of persistent HPV is what eventually leads to,
if it is not well treated or it cannot be treated,
if it's not detected,
Okay, it's not detected.
Yeah, that's what this is about.
Okay, so let me know, how common is this particular type of cancer? What's the prevalence rate like?
Globally, it has been recorded at about 529,000, according to WHO. About 529,000 women new cases of cervical cancer is recorded every year, and about 480 die from cervical cancer. Then taking it to Nigeria, studies shows recently that about 25,000 new cases of cervical cancer is recorded in Nigeria, and about 480 women die of cervical cancer. So the prevalence is quite high.
Apart from the HPV, what else can cause the cervical cancer?
A lot of women take a lot of contraceptives as well without doctor's prescription. they take some other kind of drugs which could, lead to, a lot of things that women do, insertions, using different kinds of insertions without doctors' advice or doctor's recommendation. These are some of the things that could lead to cervical cancer. And studies have also shown that it can also be genetically related. Maybe a woman whose mom had some issues of cervical cancer, or a woman which mother took some kind of drugs, which it might also be at risk.
You should be prone to
having it. Yes.
Okay, so looking at the lifestyle, the lifestyle, the habits of some people that can actually cause cervical cancer, like you said, smoking,
yes,
and multiple sexual partners.
Yes.
And what else are we looking at?
We're looking at women who have children as well.
Okay.
It's also part of it. It's not saying it causes it, but it also increases their chance of having HPV.
Okay, so let's come back to the virus, the HPV.
Yeah.
How common is this virus?
Like I said, it's about 25,000 new cases. 25,000 new cases are recorded every year, so it's becoming common.
Okay. So let's look at the prevention, the way to prevent cervical cancer. What are the ladies supposed to do to actually prevent this particular type of cancer?
Ladies and women who were exposed to sex early in their life, maybe before they were 17, they should know that they are prone to have this problem. So, and some of the prevention measures that can be taken is for women to know that there's a test called pap test, which is used to screen for cervical cancer, to screen if there are some bad cells or abnormal cell structures in their cervix. So pap test is usually recommended for ladies between 21 and 30, recommended once a year between ladies who once they are 21 and until they are 30. Once they are 30 and they seems to be having normal cervical normal result from pap test, it's usually recommended that they can now be doing it like maybe once in 2 years or once in 3 years, based on doctor's advice or recommendation. So women should know that they need to be doing pap test. Then it's also recommended that once a lady has the first sex, between 2 to 3 years, the lady must go for a pap test.
Okay, so let's look at the symptoms now. The symptoms of cervical cancer. What are the symptoms? How does someone know that she or she's at risk of having this, or that she probably has this already?
Okay, if someone is having kind of intermittent bleeding between the periods, normally women have this period, monthly basis, but when it now comes in between, the person needs to go and talk to an O&G doctor, a consultant O&G, who can check her out if she's having this virus. Then a lady who bleeds whenever she has sex, can also need to go and check her out herself. Then having insertions and all that, having pain, pelvic pain, and all that could also be symptoms of HPV virus.
Okay, so can it be treated?
Yes, of course, it can be treated. That's what the pap test is about.
Okay.
If it's detected early, before it eventually translates into a cancer. If it's detected early, if women have the lifestyle, the culture, the habit of going for pap test, then it can easily be detected. So, and the doctors can take it up from there.
Okay, so still good morning, Cross River on your dial into the station. We've been talking to Mr. Clement Sunday from Asiopo Diagnostics and Medical Center, talking to us about cervical cancer, how you can prevent it, and possibly how you can treat it as well. So thank you so much for coming on the program. It's always a pleasure having you. So, like you said, you have to do a routine check on yourself. The test is the pap test should be done once a year. When once you are 21, and when once you just start, you notice that probably your daughter has started having sex or something. She has to go through the pap test once a year to find out if she is at risk of having this HPV that could possibly lead to cervical cancer. It's getting prevalent and it's getting really common around, like he rightly said. It's still a good morning question where we try to enlighten you, let you know how you can stay healthy, because your health is our concern. Stay with us. We'll be right back after another short break.